Hello friends, on the behalf of Progressive Education Society's Modern College of Pharmacy, Nigdi, Pune, myself, Dr. Narendra Parihar, Assistant Professor, I welcome you all. Today's topic we will discuss General Pharmacology. Under General Pharmacology, these are the books which you can refer for your pharmacology subject. So there are various definitions in a pharmacology to understand the various terminologies. Then we are going to see the various sources of drugs and different routes of drug administration. So let's start with the definitions. First is what is pharmacology? So pharmacology is the science that deals with the effect of drugs on living systems, or we can say the study as to how drugs can alter the physiological or biochemical functions of a living organism. So now we will see what is drug. Drug is any substance or product that is used or intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient, means the patient. Or you can say a drug is a chemical substance used for the treatment, cure, prevention or diagnosis of a disease in human beings or animal. Now we will see the major part of pharmacology, that is pharmacokinetics and pharmacodynamics. So let's see what is pharmacokinetics. It means the movement of drug within the body. It includes the process of absorption, distribution, metabolism and excretion. So it means what the body does to the drug. In short, you can remember pharmacokinetics means what the body does to the drug. Now second, pharmacodynamics. So it is the study of the drugs, their mechanism of action, pharmacological actions and their adverse effect. So basically it covers all the aspects relating to the what the drug does to the body. So basically in short, pharmacodynamics means what the drug does to the body. Next, what is pharmacy? So we have already studied in our first year. It is the branch of science that deals with the preparation, preservation, standardization, compounding, dispensing and proper utilization of drugs. Therapeutics, it is the aspect of medicine concerned with the treatment of diseases. Chemotherapy, it deals with the treatment of infectious disease or cancer with chemical compounds that cause relatively selective damage to the infecting organism or cancer cells. Next is a toxicology. So it is the study of poisonous, their actions, detection, prevention and treatment of poisoning. Means for example, if you are taking a drug and if the dose of drug is higher, so there will be a toxicity of that drug. So to study that will be known as a toxicology. Next is clinical pharmacology. It is the systematic study of a drug in man, both in healthy volunteer and in patient. It includes the evaluation of pharmacokinetic and pharmacodynamics data, safety, efficacy, and adverse effect of drug by comparatively clinical trials. Okay. Next, orphan drugs. So drugs that are used for the diagnosis, treatment or prevention of a rare diseases. The expenses incurred during the development, manufacturing and marketing of the drug cannot be recovered by the pharmaceutical company from selling the drug. So for example, digoxin antibody, it is used for the toxicity of digoxin in the patient. Next, essential medicine. So according to WHO, essential medicines are those that satisfy the healthcare needs of majority of the population. They should be of assured quality and available at all the times in any place in adequate quantities and in appropriate dosage forms. They should be selected with regard to disease prevalence in a country, evidence on safety and efficacy, and comparative and of cost effectiveness. So for examples, iron and folic acid preparations for anemia condition in pregnancy patient. Antitubercular drugs like isoniazid, rifampicin, pyrazinamide, ethambutol, etc. So these are the drugs which should be arrived or needed at the every place of pharmacy or any healthcare department. Now we'll see what is OTC. OTC are the drugs which can be sold to the patient without the need of doctor's prescription. For example, paracetamol, antacids, etc. What is prescription drugs? So prescription drugs are which can be obtained only producing the prescription of a registered medical practitioner, means physician, that is MBBS doctor, or you can say BDS or BAMS and BHMS. So which type of drugs are prescription drugs? Antibiotics, antipsychotics, etc. Now second we will see different sources of drug. So there are mainly three types of sources, that is natural, semi-synthetic and synthetic. So natural sources are plants, animal, minerals, etc. Semi-synthetic drugs are obtained from natural and they laterly converted or modified chemically. Then third is a synthetic drugs which are produced artificially. Okay. So these are the examples which we have already learned in the first year of. Okay. Next we will see route of drug administrations. Route of drug administration is again classified into two types, that is systemic and local. Under systemic, enteral and parenteral. Enteral is again divided into three types, that is oral, sublingual and rectal. Under parenteral, it is again divided into inhalational, injections and transdermal. And there are various routes of injections for drug delivery. Okay. Under the local classification of routes of drug administration, skin topically, intranasal, ocular drops, mucosal, throat, vagina, mouth, ear, etc. So drugs and patient related factors which determines the proper selection of routes for different types of drug administration. So what are these factors? First, characteristics of drug. Condition of the patient. For example, if patient is unconscious, he is continuously vomiting, these conditions may determine the selection of different routes of a drug administration. Then emergency condition means if there is an accident, then the route of drug administration will be different. Next, age of patient, and sometimes patient or doctor's choice may be preferred. So they are mainly divided into two types, that is local route and systemic route. So first we will see local routes. It is the simplest mode of administration of a drug at the site where the desired action is required. So for example, if you administer the drug from the skin, so the various formulations available are cream, ointment, lotion, gel, transdermal patches, etc. Through the eye and ear solutions, you can say eye drop, ear drop. Okay. Next is nose and lungs. You can say nasal spray and powders. So topical. Drug is applied to the skin or mucous membrane at various sites for localized action. First we will see oral cavity. As a suspension, as a troche, as a cream, as ointment and jelly, and as a spray. Second, through a gastrointestinal tract. As a tablet which is not absorbed are given through a GI tract. Next is rectum and anal canal. So there are two examples, that is an enema and as a suppository. Okay. Next is eye, ear and nose. As drop, ointment and spray. Bronchi as inhalations. In COPD and asthma patient, inhalations route of drug administration is mostly preferred. Next is vagina, urethra, screen, etc. Okay. Second, intra-arterial route. This route is rarely employed because it is mainly used during diagnostic studies such as coronary angiography. So for the administration of some anti-cancer drugs, for example, for the treatment of malignancy involving limbs. And third, administration of the drug into some deep tissues by injection. For example, administration of triamcinolone directly into the joint space in rheumatoid arthritis. Our second classification is systemic routes. So drug administered by this route enter blood and produce systemic effect. So first, internal routes, that is from oral route. It is the most common and acceptable route for the drug administration. Dosage forms are like tablet, capsule, syrup, mixer, etc. Advantages: they are safe, cheaper and painless, convenient for repeated and prolonged use, can be self-administered. Disadvantage, not suitable for emergency condition. It is not suitable for unpalatable and highly irritant drugs, unabsorbable drugs, unconscious, uncooperative and unreliable patients, and patients with severe vomiting and diarrhea. Second, sublingual routes. Drug is kept under the tongue. The drug is absorbed through the buccal mucosa membrane and enters the systemic circulation directly. So what are the advantages? Quick onset of action. Action can be terminated by the spitting out the tablet. Bypasses the first pass metabolism. Self-administration is possible. Disadvantage, it is not suitable for irritant and lipid soluble insoluble drugs. Okay, and it is not suitable for drugs with the bad taste. Third is a rectal route. Drugs can be given in the form of solid or liquid. First, suppository. It can be used for local or topical effect. Okay, as well as systemic effect. Second is enema. Retention enema can be used for local effect as well as systemic effect. The drug is absorbed through rectal mucosa membrane and produces systemic effect. Next, we will see parenteral routes. Routes of administration other than internal route are called parenteral routes. So, what are the advantages? Onset of action of drug is faster, hence suitable for emergency condition. It's also useful in unconscious patient. It's also useful in uncooperative, unreliable patients with vomiting and diarrhea. And suitable for irritant drugs, drugs with high first pass metabolism, drugs which are not absorbed orally, drug destroyed by the digestive juices. So what are the disadvantages? It requires aseptic conditions, preparation should be sterile and it is expensive. It requires invasive techniques which are painful, cannot be usually self-administered and can cause local tissue injury to the nerve vessels. So these are the first oral routes which are local routes. We have seen the skin. Okay. These are the various types of topical routes which are applied in day-to-day life. Okay. Next in systemic route we have seen the eternal route, that is oral route, which is most commonly used for the patient to administer the drug. Second, we have seen the sublingual route, means the chewable tablet which are used and they have a quick onset of action and it is not suitable for irritant and lipid insoluble drugs, and if the drug has very bad taste then the route is not preferred for the administration of drug. Next we have seen parenteral routes. So the route of administration other than the internal route are called parenteral route. There are various advantages. Onset of action of drug is very faster, hence suitable for the emergency condition, that is accidental conditions. Useful in unconscious patient, uncooperative and unreliable patients with vomiting and diarrhea conditions. It is suitable for irritant drugs, drugs with high first pass metabolism, drugs not absorbed orally, drugs destroyed by digestive juices. And what are the disadvantages? It requires aseptic conditions. Preparation should be sterile and it is so expensive. Require invasive techniques which are painful, cannot be usually self-administered and can cause local tissue injury to the nerve vessels. So in next video, we will see the different types of parenteral routes which are inhalation and different types of injections and transdermal. Thank you. We will see in the next video the different types of route of administration.